Hi, I'm Garrett Davis. We're in Petersburg, Virginia at the Diabetes Wellness Center. And of course, our guest today is Kimberly Ketter and Sean Rivers, identical twins who at 40 discovered they had congestive heart failure. We're going to hear all about their story and more on Living With right after this. And welcome back to Living With. I'm Garrett Davis. And of course, we're in Petersburg, Virginia with my good friends, identical twins, Kimberly Ketter and Sean Rivers, dressed in red in celebration for Heart Month, right?
That's right.
Now, the first time I was here, we was out in the parking lot, Dortez and I, because it was our thought process. We would come here and talk to you guys about joining us with Mama's Girls, but then we Googled you and found out the heart condition. God had a totally different direction with us. So how did we come to grips with, heart disease? Who went to the doctor first? How did it happen?
Well, it started with me. I was an ER nurse at the time, so I was preparing to pull a 12-hour shift at work and rushing around as usual. And I went upstairs to get something that I'd forgotten, and I ran up the stairs. And I remember getting up the stairs and getting to the landing or the top of the stairs, and I couldn't breathe. And I remember holding on to the banister. I was like, phew. Well, that's weird. I must need to go, maybe I need to go work out, maybe I'm deconditioned. So brushed it off, went on to work. Went to work, got sick at work during shift change. Got really dizzy, had palpitations, got short of breath, and I became the patient that day. And they worked me up. Didn't really find anything there. EKG only showed that my heart was really fast. But they recommended that I go see primary care, so I did. Went to go see primary care and told them the story. And they really didn't think anything was wrong until I told them I couldn't climb the stairs. When I told them that I had shortness of breath when I got to the top of the stairs, that gave them pause. That set the red flag. They said, well, you're 40 years old, it's probably nothing, but let's send you to the heart doctor just in case. Let's get you to cardiology. So long story short, I went for 2 tests. I had a stress test done where you run the treadmill and they watch and check for heart damage. The other one I had was an echocardiogram, which would check to see how well my heart was actually pumping or functioning. So I got the stress test done first, failed it miserably. I couldn't even finish.
You said you failed the stress test. Exactly what did that mean?
Well, the stress test is basically a couple of different parts that we're looking for. They have you walk on the treadmill and they have you hooked up to an EKG machine. And they're checking for 2 things. They're checking for what we call ischemia or muscle heart damage, where we can see on the EKG readout, but they're also checking our exercise tolerance. They're checking to see if you can actually finish the test. So I think I might have been maybe a couple minutes in and I was like, I gotta stop. I was coughing, I was really short of breath. They said, never mind, stop. So we stopped that test. They said, let's just go ahead and do the echo. So an echocardiogram is an ultrasound basically of your heart, and it basically tells us how much blood is leaving the heart when it's pumped. It also lets us know about the one-way valves in the heart, structure of the heart. So they did that, and generally when that happens, the technician is the only person in the room. So she finished the test, she said, I'll be back. That always scares me as a nurse. That never happens. That never happens. So I said, where are you going? So she went out, got the doctor. Doctor came in, they're looking at the screen and said, well, we know why you're feeling so bad. They said, yeah, you have cardiomyopathy. I said, what? They said, yeah, you have heart failure. You have congestive heart failure. I said, that's impossible. I'm in good shape. I don't have diabetes. I don't have high blood pressure. I don't have anything. So we went back and forth. The nurse that I am, you gotta be kidding. That can't be right. So we turned the screen so that I could actually see the test myself. And I cried like a baby. And my first question was, well, what's my heart function? As a nurse, got my science brain on. And the ejection fraction, which is the percentage of blood that's pumped out of the heart with every beat, is kind of what we use to determine how well your heart's doing. Mm-hmm. Normal's about 55%. Mine was 20. Oh. It was 20% at diagnosis. Wow. So, yeah, I had to start on meds right away, and thus the journey.
So, Kim, when you saw that number 20 and being a nurse and having, all the experience, what's the first thing that went through your mind when you saw that?
I was really upset. I was more concerned of, I put my battle hat on at that point. I was like 20%, but my scientific hat said that's not good. I was taking care of patients who have EFs of 20%, and they don't do really well. I also know that statistics say at the people with that type of heart failure usually die within 5 years of diagnosis. So all of these things were going through my mind at the time, and I said, no, there's no way. I'm not checking out like this, but.
So you two are sisters. You're very close. You're identical twins. You tell each other everything. So Sean, what was going through your mind when she came and told you that she had congestive heart failure?
The first thing was, trying to support her, because it's devastating. Like she said, we've been nurses for a long time, so we know what heart failure looks like. And most of the patients that we've seen during the course of our journey as a nurse, they're older, they're Caucasian, they don't look like us. Rarely do you see, African American women, at least in my journey, in their 40s diagnosed with heart failure. So it was scary, but the initial thing was, to support her and find, okay, like the battle hat, what do we have to do? Because we got to get through this thing, but at the same time, as she was going through her diagnosis, she didn't have any of the comorbidities or anything. So what was driving this heart failure thing? You didn't have high blood pressure, didn't have diabetes or any of the other things that would, give her that. But we do know that it has a genetic component to it too. Right. So that sort of led into her saying, well, maybe you should get checked too. I said, well, it's probably nothing. We work 2.5 jobs, so we were always tired. Right. So I said, well, okay, I'll go get checked just to kind of alleviate her concern for me so I could put my focus back on her.
So Sean, now when you went to the hospital, knowing the things that your sister had gone through, what was the story like for you? What happened in that room?
So about 3 weeks later, made the same appointment with my primary, and they referred me to cardiology just because of the story that I told them about my sister. And they said, it's probably nothing, but just to alleviate your concern, we'll send you to cardiology. So we ended up at the same cardiology office, different providers, but the same cardiology office. So they scheduled the same test, the same stress test, and the same echo. So they put those electrodes on and got me on the treadmill about a minute and a half in, coughing and can't breathe. And it's like, okay, stop. I'm like, this is not going well at all. So let's go ahead and do the echo. So we get the echo, and I'm laid out on the table, and the tech says, I'll be right back. And I'm looking at the corner of my eye, this is like a repeat, like, like Groundhog Day. Like the movie Groundhog Day. And so the doctor comes back in and said, Ms. Rivers, we think we know what's wrong with you. You have cardiomyopathy. And I almost wanted to laugh if it wasn't, so serious. But her ejection fraction was 20 and mine was 30. Wow. At diagnosis, yeah.
Two African-American women with congestive heart failure, Kimberly Ketter and Sean Rivers. When we come back, we're going to discuss their journey with their families and what they had to go through. And welcome back to Living With. I'm Gary Davis. This time around, let's talk about when you found out you had congestive heart failure. What was the first thing that was going through your guys' mind?
Statistically, folks who are diagnosed with congestive heart failure die within 5 years, especially with the EF that I had. So very fortunate. We're now 12 years out, I think, from diagnosis. So we're very fortunate. It's been a tough journey. I'd have to say that the first year was probably the worst. Because prior to that, I wasn't taking any medicines regularly at all. I was taking nothing, multivitamins and that kind of stuff, but no prescription medicine at all. And the medications that are helpful with congestive heart failure can sometimes cause some side effects, which all medicines do, but you weigh benefits versus risk. It's going to help me more than it's going to hurt me. So one of the symptoms of the medications is a group of medications called beta blockers. And what it's designed to do is to try and strengthen the heart, slow the heart rate down so it's not overworked. But they make you feel exhausted. The medication made me feel more exhausted than the heart failure itself for several months. I was miserable. And I remember, I said, I can't function like this. And I remember talking to my doctor about it. I said, look, I got stuff to do. I can't feel like this. I'm exhausted. I mean, literally struggle to get off the sofa. I said, there's got to be something else. I can't do this.
Right.
I said, so what options do you have? He said, well, you could not do well. You could die. I said, what was that dose of medication you said you wanted me to take again?
You guys are taking all this medication. So, Sean, exactly how many pills was it, are you taking a day, and it's the same as what Kim is taking?
No, actually, I think Kim's dose was a little higher than mine because her EF was a little lower than mine. So
Right.
our doses were different. Yeah, so there was and our doses are still a little bit different now, and our medication regimens are actually different. Even though we're identical,
Right.
it's still different.
Yeah.
And there's another group of drugs that we actually had to take called the ACE inhibitors, which helps as well. But I had a terrible reaction to the drug, so I can never take that again. But she can still take them.
Okay, so we're like 12 years in now from that first diagnosis. Let's go back to that first year. How was it like in those first few months, weeks and days of having congestive heart failure, especially with the family?
Even just as a nurse, we're care collectors and we're always taking care of everybody else. And with my daughter Sydney, I always try to not tell everything, because you want to be that you're always a protective person, because you don't want them to hurt or worry about you, because you always want to take care of everybody else, So even when I was kind of going through that, there was still a lot that I didn't say, even when I was exhausted or hurting or didn't feel good. You always put on that brave, and I think that's kind of where she gets it from. So you feel okay, I feel fine, and you feel like you're about to hit the skirts. So a lot of it, but she always picks up when I'm not well, so I may as well tell her because she knows anyway. But that was just sort of how I coped.
So you two ladies are very active and you love New Edition.
Woo! Yes, yes.
Okay, so that means that you love to dance, you love to have fun, but at your church, there's this rock climbing event that takes place. What's the significance and importance for you two about that whole rock climbing?
So every year, well, pre-COVID, our church has homecoming, and they always have a rock wall there. So every year, since we were diagnosed, we sort of made an effort to climb this wall. And it takes a lot of effort. It's just like when she couldn't climb the stairs. So every year that God allows us to be here, we always said we're gonna climb this wall together. And it's hard because it takes a lot of effort. It takes a lot of breath to get to the top of this rock wall. And I remember the last time that we did it, and we always have someone kind of record our efforts, But the last time we did it, we were so tired. We were kind of going through some medication adjustments and things like that. And I remember Kim got up there, and I got halfway up, and I fell off the wall. And I was so exhausted, and I was dizzy, and I was breathing real hard. And I'll never forget, Kim was like, she like became this drill sergeant. You get off of that ground, and you get up here, and you get up here. And I said, I can't say, I'm gonna wait up here. You get up here. You're not gonna leave me up and get up here. I said, oh my God. So I climbed the wall, and I finally got up there, and then we came back down.
Wow. You rang the bell.
Because there's a bell at the top that you ring when you get to the top of the rock wall.
So you two, it's obvious, our viewers can tell that you didn't let heart failure stop you. You guys went back to school, you got your certification and nurse practitioners and all of that. You didn't let heart failure stop you guys at all.
We were in school. We
school.
Finished grad school. She's a nurse practitioner, and I advanced diabetes clinical nurse specialist. So we went on and finished, and got our clinic going and that kind of thing. So we got things to do.
When we come back after the break, we're going to talk about why these two young ladies started a diabetes clinic here in Petersburg. And welcome back to Living With. I'm Garrick Davis. We're here inside the diabetes clinic here in Petersburg. So how did this whole project come to take part?
Well, Sean and I, most of our nursing experience has actually been at the VA hospital. That's where a majority of our nursing career has been. We were nurses at the VA, I think over 25 years.
Since 92.
92, yeah. So most of my career was in emergency medicine. She worked in surgical clinics. But part of that journey, I stepped out of the ER for a little while and went into case management. And my job as a case manager there was to assist people in my clinic who had diabetes, to help manage them, get them better controlled, to educate them. And through my work there, it just dawned on me. I said, gosh, I can't imagine if this small community is really struggling. What's my community doing? You know, how are people that look like me handling this, who don't have access to the VA, who don't have access to education classes and things like that? How are they managing this? So we prayed a lot about it. You know, of course, we talked to Sean about it. People thought we were nuts. They're like, wait, let me get this straight. You're gonna leave your good government job with your pension to just go out there and do it? We said, yep. We cashed in our 401ks and we pulled it and we opened a clinic. We prayed about where we would go though. You know, there were a lot of places where we could open, but we actually went on the CDC website and did our research and looked at statistical data and found out where the greatest need was. And the greatest need is right here in the Crater Health District, you know, which includes Petersburg, Hopewell, Dinwiddie. Okay. So we knew folk needed us. We knew we had something to offer them. So prayed about it, and we opened up about almost six years ago now.
We're now living in a world where it's a pandemic. You got to wear a mask. You got to, you know, be overly precautious about certain things. You guys run a diabetes wellness clinic, and you're taking care of yourself, but you also got to take care of others. In the midst of all of that, it's a pandemic. How has this pandemic affected your business?
It's been tough. Last year, March, you know, when at the height of the pandemic, you know, we, of course, like many other businesses, we actually had to close our doors for about 3-4 months. And it was tough. There was a money loss, of course. Financially, we took a really huge hit. And then we were lucky enough to be able to reopen with, you know, some grant funding and, you know, some community help. A lot of our patients took a hit as well, you know, with their job loss, and they lost with the job loss, they lost their insurance. But the reason why we came here was to make sure that their needs were met. So even if they, you know, lost their insurance and they couldn't pay us, we still saw our patient.
We were talking off camera about how the pandemic has affected people here in Petersburg. And some of your clients, you know, can't afford that copay, but because of your heart, because of that mission, you serve the least of these, you still saw patients. But tell me about some of those stories that how the pandemic has affected, you know, the people here.
Our patients will come in, and of course, even if they have copays, I mean, it's not fair to assume that people struggle because they can't afford $25. $25 is a lot of money to some people, you know, and if you just don't have it, you don't have it. $25 for a copay or $25 for food on the table or for what have you. So a lot of our patients were struggling with that in many instances, and of course in line with what everybody else was doing from a clinical standpoint across the nation during the pandemic. We were curbing the co-payments. Don't worry about it right now, you know, and you pay us when you can, or we'll send you the bill later. Just come on, because at the end of the day, because what COVID has taught us is that it affects certain demographics disproportionately, and it affects folk that look like us. It affects folk who we serve, who have diabetes, who have hypertension, who have heart disease. So the last thing we need to do in this moment is not see the patients who need us the most. You know, I mean, our whole goal and our whole passion and mission is to care for the least of these. It's biblical, and that's what we do. You know, we just understand that even with our heart failure journey, God didn't spare us by accident. There's something we're supposed to be doing. So every day He's showing us a little bit at a time. This is who you're supposed to help. This is you're supposed to help. And patients are really appreciative of that. You know, they'll bring us, I don't know if that's the best thing to do, but they'll say, I made a fresh pound cake in a diabetes clinic. But we'll say, I'm not diabetic. Thank you, ma'am. You know, it's almost like the old barter system, you know, that folk used to use back in the day. But yeah.
Because we actually had a patient that, you know, we have a lot of entrepreneurs that come and do the pandemic. You know, they lost a lot of their business. You know, we had one in particular who, you know, owns a business and couldn't pay us for months and months and months, but was doing so well. You know, we continued to see this patient and, you know, had a lot of weight loss, was doing real good, diabetes was doing really well. And then, you know, finally came back to see us and, you know, presented us with the bill, said, you know, I would like to pay on my bill.
Mm-hmm.
You know, and then, you know, well, how much would you like to pay today? You know, I'm going to pay it all.
Wow.
You know, and that, you know, that just kind of, it's a community thing with us. You know, we're out to serve the village here. So that's what we're here for.
When we come back after the break, we're going to talk about a play that was inspired by these two young ladies called Sisters at Heart. We'll be right back. You ladies do a great job of always taking care of others, okay? But we got to make sure that you take care of yourself because we need you two around for a while. But for those that are watching, especially our women, what would you tell them they need to do or concentrate on about taking care of themselves?
And that's the thing. I think that's probably what drives us the most. We understand as black women have been the backbone of our communities for centuries. You know, we take care of the whole world, make sure you're okay, but then we look in that mirror and like, what happened? You know, we're falling by the wayside. It's really important to know your body. We tell most of our patients, make a mental snapshot on what your good day looks like. And then always keep that in the back of your mind so when you're not having a good day, you have something to compare it to. And the thing about that is not to ignore it. Don't do what I did. I completely brushed it off because, you know, day to day just got me. But we really try and encourage people, you gotta take good care of yourself. Make sure you understand what the symptoms are. You know, cardiovascular disease affects 1 in 3 women, especially women of color. So it's not something that happens rarely. It happens all the time, and we've got to take better care.
I always tell my patients to be the CEO of your healthcare. You know,
CEO of your
be the
healthcare.
CEO of your healthcare. You know, whenever you go to the doctor's office, make sure you get all the information. If you have questions, write your questions down prior to your visit because you're bound to forget something.
Right.
You know, you allotted 15 minutes for a visit.
Right.
You know, so make sure you write your information down and your concerns down prior to your visit.
So I'm going to play something for you two, and I want to see if it's going to take you back, okay? Just kind of want to see what you guys think about this.
Based from true events from the lives of Kimberly Kenner and Sean Rivers, who at Fort discovered they had congestive heart failure. Get ready for Garrett Davis's Sisters at Heart.
Are you gonna be okay? Please, just tell me the truth.
God is greater than any problem you may ever face.
Reaction, y'all take a reaction.
I'm not going
The ladies.
Saturday, August the 24th at 3 p.m. at Good Shepherd Baptist Church in Petersburg, Virginia. Get ready for Sisters at Heart.
I'm deal with what I'm doing. I am the one with congestive heart failure, not you.
In part by Petersburg,
Okay.
Petersburg
I need you
Sheriff's
two.
Office, AARP Virginia, Real Possibilities, and G. Davis Productions. Get ready for the hilarious stage play, Sisters at Heart. Wait a minute, you're taking me too fast. I ain't young as I used to be. I used to do all night. Take me all night to do. Saturday, August the 24th.
So does that bring back memories?
Oh my God. When we first met, you know, we, of course, like you said, was going on down a whole nother path. But what God has revealed, there's purpose in pain. You know, He doesn't waste or hurt at all. And when the night we first saw the play, because you wouldn't even let us come in on rehearsal, remember?
Right.
Because you said you just wanted to see our raw reactions. And it's exactly what we would hope that people would get. You know, we cried at certain moments because it just brought everything back. The funny moments, oh my God, and the music. They put new addition in. They put our guys in, and we really weren't expecting that.
And they had the choreography down.
It was so great. And even to this day, when we were here in Petersburg with the play, our patients still talk about that. Right. They say, I've got a bus load ready whenever COVID goes away.
They had, even to the point where for our birthday, they brought us a new edition engraved glass because they went and saw the play. It's so bad.
But it was so amazing. It was funny. It was serious. And one of the good parts about the play that you came up with, Garrett, is really good is at the intermission. So you call it edutainment,
Right.
is what you call it. So we're not only there to entertain, but we're trying to really drive home a message and trying to make sure to meet people where they are. People get healthcare information differently.
Right.
This is a great way to do it. So creative, and it's just an honor to work with you, man. It's just good stuff.
But it not only did that, but it also pulled in, the whole family aspect surrounding, what happens when a family member is diagnosed with something, as serious as heart failure. So it connected all the dots.
You know,
and-
all of our productions within our family are sponsored nationally, and I thought that Sister Heart would follow right suit. It hasn't been. It's been hard nut to crack, so to speak, trying to get that national support. But we pledged we're gonna do it regardless. And because just when you two lit up, when you saw
Oh,
that
man.
trailer, people light up, people learn differently, and when they see the characters on stage, and it has to go forward. It just
Yeah,
has to, and
it
we're
has to.
excited that even before this this COVID is over with, we're gonna be recording an episode of Sister Heart, and it's gonna be on film, and it's gonna be on Roku TV and Amazon Fire TV. I'm
Yes.
excited to announce
We're
that.
so excited. We're so excited.
So the work will go forward, but I think it's amazing to see you two light up, and it's about you. So you can imagine what other folks do when they see Sisters at Heart. So Sisters at Heart will be coming to a city to you soon once this pandemic is over. But
We
in
can't
the
wait.
meantime, we're dedicated to recording an episode and getting it out there as much as we can.
We're excited. We're
Awesome.
excited. There's definitely an audience for it. We're excited.
Absolutely awesome.
Right. This has been another edition of Living With Kimberly Ketter and Shawnee Rivers, living with congestive heart failure. We'll see you next time on Living With on G Davis TV.